Today we're going to talk about something that a lot of people want to know is about crepitus. Crepitus is a term that's used to describe clicking, cracking, or popping noises you might hear when you move a joint. This sound can range from a soft muffled noise to something so loud that others can hear it. It might also even feel like a sensation of grinding or crunching. There are two types of crepitus. There's bone crepitus and there's joint crepitus. Joint crepitus involves sounds or sensation of the soft tissue in the joint or cartilage, and this usually results from movement of the tendons, ligaments, or even cartilage surface over one another. It also can be caused by gas bubbles in the lubricating fluid. It is generally harmless unless it's accompanied by pain, swelling, or loss of function. Bone crepitus now involves the sound of bone-on-bone contact, and it's often linked to more severe conditions like advanced arthritis or fractures. As we get older, crepitus can become more common. The more common of the crepitus types is joint crepitus, and is generally harmless. However, if you are experiencing pain or discomfort along with the crepitus, it may indicate a more serious issue, like joint damage from conditions like gout, arthritis, inflammation from something like tendinitis. In most cases, crepitus can improve on its own without any treatment. However, to really manage it, you may want to apply ice to the affected area, or even seeing a chiropractor for adjustments, or even seeing a physical therapist for exercises. You should be more concerned if your joints are cracking, popping, and if you're also experiencing pain or even swelling or discomfort. In most cases, it's best to consult your primary care doctor or chiropractor. Now, if you want to stay up to date with information on how to live a healthy, pain-free lifestyle, please subscribe to our channel.